home and community-based services during the pandemic. The coronavirus has disrupted businesses, schools, and our daily lives. But for people with intellectual and developmental disabilities, the risks are very high. Regardless of age, people with intellectual and developmental disabilities are 2.7 times more likely to get the virus. And the virus has put a big strain on the supports that people with disabilities and certain seniors need to stay safe and healthy in their community. Those supports are called home and community-based services. That's what Noel Garcia uses. Here he is on the streets of Twin Falls. Home and community-based services gives Noel the ability to get up in the morning and to move about the world. But there are some real signs of strain in Idaho. An Idaho group of disability service providers, the Association of Community Providers, tells us that providers have had to cut back services and reduce their staff compared to what they could deliver before the virus. A national survey out of the University of Minnesota indicates that direct support workers are leaving the work for reasons like they don't have childcare. They're concerned about getting sick with the virus. They don't want to risk getting people with disabilities sick with the virus. And a few have tested positive for the virus. We could reduce this strain through something called an FMAP increase. FMAP is the federal match rate for federal dollars coming into Idaho to pay for Medicaid. If we could bump home and community-based services up by 10 percentage points, Idaho would be in a much better place than we are right now. In fact, without that federal match rate increase or some assistance, Idaho could see a 15 to 25% cut in Medicaid services by fiscal year 2022. That's according to the Department of Health and Welfare. So that's kind of troubling. Without additional help, the state of Idaho will need to make deep cuts to Medicaid, and those cuts will put people with disabilities and seniors at risk, like Skip and Jenny Newsom. Jenny works 2 jobs already to provide the care that her brother Skip needs. Without adequate home and community-based services, many will be displaced, homeless, or institutionalized. And that just increases the risks of getting the virus. But there are ways to help. We could assist recipients of home and community-based services, the people who get the services, with technology. Many people don't have access to technology, and some services can be delivered that way, and folks would feel less isolated. There are other ways to help. Making protective equipment like masks and gloves available to the direct support workers only makes sense. That way people don't have to scramble just for basic protection against the virus. Another way to help would be by providing funding specifically for training to direct support workers, so that everybody stays on the same page about virus safety. These ideas and others would go a long way towards stabilizing Idaho's home and community-based services. We need to protect the workers, the small businesses, and the nonprofits that provide these services so they can remain available to all of our communities. We're asking U.S. Senator Crapo to be a champion of home and community-based services and to add it as part of a new Senate relief bill. We're asking you to call Senator Crapo at his Washington, D.C. number of 202-224-6142 and ask the senator to Boost the funding for home and community-based services. Ask him to make sure that the workers are trained well and that they have the personal protective equipment that they need against the virus. Ask him to help the state of Idaho keep people with disabilities safe in the community, not in institutions. Ask Senator Crapo to add support for home and community-based services to the final Senate version of a new relief bill. Thank you. Together we can make a difference, and I hope you make that call very soon.